In viruses as in life, change is inevitable. Since the COVID-19 pandemic began, scientists have identified hundreds of new variants of the virus, each with slightly different mutations. In Taiwan, all eyes are on the Delta variant after a cluster infection in Pingtung County. But what's special about Delta, and how worried should we be? The World Health Organization, or WHO, groups COVID variants into variants of concern and variants of interest. Delta is a variant of concern. Like all variants, it has a place in the virus's lineage. This graphic is a big family tree showing how all COVID variants are related. And here's a simplified version with all the WHO variants, with Delta on the right-hand side. Delta is closely related to Kappa, a variant of interest also first found in India. According to the European Centre for Disease Prevention and Control, Delta has 4 spike mutations of interest. One mutation is common to all WHO-listed variants. The second is shared with Epsilon and Kappa, the third just with Kappa, and the final mutation is unique to Delta. What does this mean? Well, the WHO and the US Centers for Disease Control and Prevention, or CDC, use similar criteria to say whether a variant is of concern or not. Essentially, those are: could the variant make diagnosis, treatment, or vaccination more difficult? Could it spread more easily? Or could it cause more severe illness? We'll look at these in order. So could Delta make diagnosis, treatment, or vaccination more difficult? Well, the short answer is possibly. The US CDC website points to this research paper. It looks at the Epsilon variant, which has one of the same mutations as Delta. The paper suggests decreased antibody neutralization, or essentially a weaker response to the virus, even among people who were vaccinated. But it still hasn't been peer-reviewed. The good news is that Public Health England in the UK says vaccines are still very effective at preventing hospitalisation. The organisation says if you've had 2 jabs, you're unlikely to get sick and you're even more unlikely to need to go to hospital. Okay, moving on to our second cause of concern. Could it spread more easily? The short answer is yes. Research from Public Health England suggests that the Delta variant is about 60% more transmissible than the Alpha variant, which was first detected in the UK. And remember, the Alpha variant itself was already much more transmissible than the original virus, so it's likely Delta could spread quickly in Taiwan if not contained. That brings us on to the final question. Could it cause more severe illness? The short answer is it's not clear yet. Right now, the Delta variant is driving a surge in cases in the UK, but there hasn't been a big rise in deaths. That's probably at least partly because most high-risk groups have already been vaccinated. Some data also suggests that the variant could be less deadly than the Alpha variant. But those numbers could change, so right now it's too early to tell. As for people in Taiwan, regardless of the variant, the guidance stays the same. Keep away from big groups, wear a mask, stay at home, and get a vaccine when you're eligible.